In the PARADIGM-HF study, a new agent in heart failure, an angiotensin receptor neprilysin inhibitor known as LCZ696, was compared to enalapril in 8,399 patients.
Primary endpoint was the combined risk of cardiovascular death and hospitalization for heart failure, and LCZ reduced the risk of that endpoint by 20% above and beyond enalapril, with an extremely small p-value. Amazingly enough, the new drug, LCZ696, had fewer side effects than the gold standard. We now have evidence that this new approach, angiotensin receptor neprilysin inhibition, is better than our current approaches to inhibiting the renin-angiotensin system in patients with heart failure, and should represent the new cornerstone of treatment.
CONFIRM-HF randomly evaluated the impact of iron deficiency treatment with 4-ferric carboxymaltose on clinical outcomes in 304 patients with heart failure and iron deficiency.
We confirmed that the treatment of iron deficiency is very effective. It improves patient symptoms, exercise tolerance, quality of life, and may reduce the risk of heart failure hospitalization. This is extremely important because it translates into a context that we need to seek for iron deficiency in all our heart failure patients. The take-home message is, again, very simple. If you have heart failure patient, consider to seek for iron deficiency, number one, using a very simple biomarkers, ferritin and transferrin saturation. And once you detect it, make sure that you treat this because it improves patients' symptoms, exercise tolerance, quality of life, and reduces the risk of heart failure hospitalization.
NECTAR-HF is a proof-of-concept study that tested the impact of vagal nerve stimulation on 96 patients with heart failure.
As a first controlled study and sham-controlled, randomized, prospective, this study could not show a positive effect on remodeling exercise capacity or BNP. So as such, this resulted in neutral. But we had a significant effect on symptoms, and therefore we need to further evaluate this therapy in different settings.